Good morning and welcome to the AdventHealth News Briefing. I'm Tom Johnson from AdventHealth TV. This week, the Centers for Disease Control and Prevention recommended a smaller dose of Pfizer-BioNTech's COVID-19 vaccine for children aged 5 to 11, the final step needed before shots can get into younger arms. Today, we are going to answer your questions about this latest news. Our guests today are Dr. Michael Keating, Chief Medical Officer for AdventHealth for Children, and Dr. Fatma Levent, Medical Director of Pediatric Infectious Disease at AdventHealth for Children. Welcome to both of you.
Thank you.
As always, we would love to answer your questions. You can ask them in the comments section here on Facebook, or you can text us at the number on your screen, 407-490-3075. 407-490-3075. And now is the time to send in your questions if you have them. Also, a reminder for the media, if you do have questions on topics other than what we are talking about this morning, we're happy to help you with that, but please send those to our external communications team here at AdventHealth. All right, Dr. Keating, let's start with you. With the news this week, we know a lot of parents want to know when and where they can get their child vaccinated. What do we know at this point? I know it's early.
It's early, and we were in the dark until last evening when a little light was shown on the answer, which is that ordering will begin next Tuesday from the directives from the state, and then the vaccines should be available very soon afterwards. And I think parents should realize that giving kiddies shots is a little bit different than giving it to adults. So I think you'd like to pick out a kid-friendly environment, whether that would be your pediatrician's office or perhaps the local high school. I know Orange County has come out with a list of the high schools that will be giving the shots, or a pediatric urgent care, Tom, would be good options.
Yeah, this is news that a lot of parents and families have been waiting to hear, that the vaccine is available for younger children. But they might also have some questions like, what do we know about the safety of the vaccine in younger children?
Well, Tom, it's there were 3,000 children in the initial trials, and it was better tolerated with less side effects than it was in the adolescent group and the adults. Extremely safe and no serious side effects, which I think is very, very encouraging. You know, there's 28 million children in this age group of 5 to 11, and none of them, Tom, should die from a vaccine-preventable disease. We can beat COVID. These kiddies need to be vaccinated.
Dr. Levent, the recommended dose is smaller than it is for the adult dose. Why is that?
Yes, Tom, it is actually 1/3 of the adult dose, and this comes from their safety data, and it is 1/3 of the dose because they have seen in this age group it works very well. We have very good, robust immune systems on the younger kids, and we think that may be one of the reasons. So it works very well from 5 to 11.
And we have not seen children die from COVID-19 at nearly the same rate as adults. Why is it important for kids to get the vaccine?
That's one of the very important questions, actually, I want everyone to understand. Even if they have much less severity, and some of them might be asymptomatic or have mild symptoms for kids versus adults, they still get the infection, they still can pass it to others, so they can bring the infection into their families and they can pass it around. And everyone who is eligible should get the vaccine in the whole family if possible. And also, kids can get very sick. We have had multiple very sick kids getting into the hospital with prolonged hospitalization, and unfortunately some of them died as well.
Well, thankfully, the numbers have receded since the peak in August with the Delta surge. Dr. Keating, if the rate of community spread is currently low, is there an urgency to get more adults and children vaccinated?
Yes, and we need to be unrelenting in that regard. We cannot forget the lessons of a few months ago, Tom, when the positivity rates went very low, as they are now, and we became complacent and we let down our guards. We have not reached herd immunity. Less than 80% of adults are vaccinated, and in the 17-year-old group, only 50% of patients are vaccinated. And we already know that COVID can mutate, and if it does, who's most at risk now? It's the children. And you remember a few months ago, our hospital was jammed with patients, and all of whom were not vaccinated. And I don't want our children's hospital to be filled with children who are not vaccinated. So we can't avoid it, and as Fatma has pointed out, kids get sick and they can die. And each of those deaths should be preventable.
I think it's worth reiterating what you just said, that before our hospitals were jammed, just before, it was very low like it is right now. So I think a lot of the things we've been talking about throughout this entire pandemic, masks and other measures to stop the transmission, we really need to keep those in mind, right?
Absolutely. And I know there's a lot of debate about masks, and you know my point of view about that. If masks are only 10% efficient, as some anti-maskers have pointed out, and it keeps one child, your child, out of the hospital, out of AdventHealth for Children, wear your mask. We don't know which child that might be, which child might get sick, which child might potentially die. This is the group that is most at risk right now, Tom, and we need to continue to do the right things and continue to practice those measures, cleaning your hands, masking, and where possible, some social distancing, as we're doing right now.
You read my mind. I was going to answer that question for anybody out there who may be thinking that. We don't have masks on, but we have them very close by. We're appropriately socially distanced, and when we're off the air, we'll have these masks back on. Thank you for bringing that up. Dr. Levent, what kind of side effects can parents expect when their child receives the vaccine? Is it similar to what we've seen in some adults?
It is definitely similar to what we have seen in adults and older children, and it sounds like, actually, from the data that we have seen, it's very effective. It's 91% effective, and it has milder side effects. The most common one I was able to review was pain at the injection site, and also arm pain, but others are maybe feeling little myalgias, muscle pain, little pain over the body, and some headaches. Some of them had some fevers as well, but it's very short-lived. It's probably 1 to 2 days at most, and they tolerated really well, even better than the older kids too.
Myocarditis is one side effect that has been looked at very closely. What's the actual risk of something like this occurring, and how does that compare to acute COVID-19 infection?
That's a great question too. So I'm going to start from this population, 5 to 11. The study that they have done, actually they had 0 myocarditis on this age group. Of course, when we give it to the big population, we will be watching that very closely. And it is rare in the older age group that was reported. We have seen some of these kids at our hospitals, very, very rare, and they do really well. They don't stay in the hospital as long as somebody who had COVID, because we have seen myocarditis with the COVID infection, and also with MISC, the multi-system inflammatory syndrome in children. That one causes myocarditis as well. So we see those kids suffer a lot longer from myocarditis than people who got the vaccine.
Dr. Keating, we all know there have been a lot of myths and falsehoods spread about the vaccine. So let's settle some of those. First, does this vaccine contain the virus?
There is no live virus in the vaccine, Tom, and you cannot catch COVID from the vaccine.
Well, that's my next question.
and the vaccine does not cause problems with fertility. There's no plausible way that could happen. What the vaccine does is it sends a message to the cells after being injected to make a protein that's very similar to the outer membrane of the actual virus. So that turns on the immune system. And when the real virus hits, you're ready to go. But that mRNA that's in the Pfizer, it's discarded immediately. I heard a nice analogy, Tom. It's almost like getting an email. You get the email, you get the data out, and then it's dumped. It doesn't change the hard drive, okay? But we learn from it, and we've got to learn. This is very, very safe. There have been 400 million shots given. We know what the experience is in adults and adolescents, and as Fatma's pointed out, it's probably even safer in little kiddies because their immune systems are so robust. Get the vaccine.
All right, Dr. Levent, a common myth for you now. Does this mRNA vaccine have the ability to change human DNA? How does this vaccine work?
And as Dr. Keating mentioned earlier, it is like an email. It comes to your body, gives the message, and then it gets degraded. So it does not affect the DNA, and that's one of the most common myths that I've been hearing. It is a misinformation, a disinformation. It does not change the DNA.
All right. Don't forget, the phone number to text your questions for our guests is on your screen right now, 407-490-3075. 407-490-3075. Dr. Keating, we do have a question from the media for you. This is from Ezzy Castro of News 6, who asks, what is the message for those parents who are hesitant? What do they do?
Hesitancy is a very common thing, Tom, and I think playing back to your earlier question about what to do in schools, for example, we know from the adult and adolescent experience that it's not going to be that all 100 of the 100 kids are going to rush in and be vaccinated. 1/3 will do it immediately, probably. There's going to be some hesitancy. I don't want to be on the crest of the wave in the middle third, and maybe there's going to be a third that refrains until it shakes out, until they're proven otherwise. I'd encourage you to get it immediately because I think this is extremely effective. But if you're in that middle group, watch and see your friends, see how the kiddies do, and give it very strong consideration to go ahead and get your children vaccinated as soon as possible.
Dr. Levent, we have a question from Facebook for you. What if a child is 11 when they get their first dose, but turn 12 before their second dose? Which dosage do they get?
They can get the adult dose as they are eligible for it, but even if they get the 2 lower doses, we anticipate that they're going to have a really good response to it as well. But they can start with one. I encourage everyone to get the vaccine as soon as possible because it starts working early, and then you just remind your immune system with the second dose, but they can get the full dose as they turn 12.
Dr. Keating, you mentioned schools. We've already seen a loosening of mask requirements at public schools. How important are these right now, and can we eventually stop using masks as more children are vaccinated?
I don't think we have herd immunity yet, Tom, and I wouldn't do it. And we already know, again, in the classrooms, a significant number of those children will not be vaccinated yet or immediately. And as in the adult population, kids, you can still get COVID even if you're vaccinated. We don't know the big experience yet in children, but that's another possibility. So until we really have the strong data that we've reached herd immunity with this potentially devastating disease, a disease that can mutate and cause the same third wave iteration of what we saw here a few months ago in all those non-vaccinated adolescents and adults, wear your mask, wash your hands, make it part of your daily routine. And I would strongly encourage schools to continue to do the same.
If a child has already been infected with COVID-19, Dr. Levent, should that child still get vaccinated?
The answer is yes. So we highly encourage them to go ahead and get it because a recent study actually showed that vaccination creates better antibodies than the natural infection, and it doesn't stay in your system too long. So if you've had the COVID, we have been recommending about a month maybe after the actual infection, you can go ahead and get vaccinated.
So while we're in the middle of the pandemic with this relatively new illness, COVID-19, we are also in the middle of a disease that's been around a long time, flu season. So what do you recommend to parents about getting flu shots for their kids, Dr. Levent? Is it okay to get a flu vaccine and a COVID vaccine at the same time? What about other childhood vaccines?
Yes, actually you can get both at the same time, and it is encouraged actually. We were just listening to all of the recommendations from the CDC and American Academy of Pediatrics, so they are encouraging to go ahead and give the vaccines because it's easy, it's safe and effective, and if we can get the flu vaccine early on, that way we don't have to deal with the complications of that with our children as well.
Dr. Keating, we have another question from the media for you. This comes from Amanda Castro with News 6. When will AdventHealth receive pediatric doses of Pfizer's COVID vaccine? How will the hospital system determine who and how they administer it to patients?
It's a good question, Tom. The specifics really haven't been worked out completely. Again, the ordering will take place next week, and we're in discussions about the different venues that it might be distributed. Certainly in the pediatrician's offices would be one option. We've talked to our pediatric urgent cares about making some events in those places, and we have some other things in mind that we'll be letting folks know about it when the details become more apparent.
Dr. Levent, Amanda Castro has a follow-up question. Where do we stand with vaccinating children younger than 5?
The studies are ongoing for younger children, so we don't necessarily know when it's going to be, but I'm hoping that we will have more data about that in the next couple of months.
Yeah, and of course, as we get more information, we will be passing that on.
Sure.
Dr. Levent, Dr. Keating, I want to thank both of you for being here. It is always great to have you, and always great for you to join us. We really want to say thank you for tuning in, and we will be back at some point very soon.